Welcome to the Cenario podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome back to the deep dive. You've probably noticed it too, this huge surge in looking for, non-traditional ways to support mental health. Things like depression, anxiety. People are exploring beyond the usual paths, looking at nutrition, overall health.
Absolutely. It's a big shift.
So today, we're zeroing in on one nutrient that comes up a lot, vitamin D. We've got your sources here all focused on vitamin D dosing for depression and anxiety. Our mission really is to pull out what the science actually says right now, who might benefit, and critically figure out the dosing because it seems pretty complicated.
It is complicated and important because this whole conversation starts with a huge global issue, vitamin D deficiency. It's everywhere.
Yeah.
And the suspicion, the thing that really kicked off a lot of this research is this potential link between being low on vitamin D and, higher rates of mood disorders.
Okay, so let's start with the basics. What most people probably think they know about vitamin D sunshine, milk, strong bones.
That's the foundation, exactly. It's absolutely vital for helping your body absorb calcium. Can't have healthy bones without it. And it's also a big player in the immune system. That part's, pretty well established, undisputed.
But the sources you share, they take it quite a bit further. It sounds like vitamin D isn't just about structure or immunity. It's involved in the brain, the control room.
Precisely. That's where it gets really fascinating. Newer research is showing vitamin D acts less like a typical vitamin and, more like a steroid hormone.
A hormone?
Yeah, influencing a whole range of things in the body, including brain function, and specifically mood regulation.
Okay, so it's acting like a hormone in the brain. How? What's the proposed link to something like depression or anxiety?
Well, the main idea, the hypothesis, is based on receptors. Vitamin D receptors are actually found all over the brain, especially in areas we know are involved in mood and how we behave.
Okay.
So when vitamin D clicks into these receptors, the thinking is it influences how key neurotransmitters are made and used. We're talking about the big ones, serotonin, dopamine, the mood chemicals.
Right, the chemicals that directly impact how we feel.
Exactly. So the logic follows. If you're really low on the key the vitamin D needed to turn these receptor locks, then the system might not function optimally. Your mood, your emotional stability could be affected. That potential direct line to mood chemistry is why taking extra vitamin D supplementation has become such a hot topic for potentially helping with depression and anxiety.
That completely changes how you think about it. It's not just, basic body health. It's potentially providing the raw materials for your brain's chemical balance. Okay, let's shift from the theory to the hard evidence. What are the big studies, the meta-analyses actually saying? Does it work for depression?
For depression, the findings are, I'd say, encouraging, but with a qualifier. These large reviews do confirm that, yes, taking vitamin D can lead to a moderate reduction in depressive symptoms.
Moderate reduction, that sounds positive. But you said a qualifier. There's always a catch, isn't there? What's the fine print?
The fine print is absolutely crucial and honestly often missed. The sources are very clear on this. The biggest, most consistent benefits, they are almost entirely seen in people who start out with really low vitamin D levels.
How low is low?
Specifically, the data points to levels below 20 nanograms per milliliter. That's NGML.
20 NGML. Okay, help us put that number in context. I think general health guidelines usually aim for something higher, right? Like 30.
That's a really important distinction. Yes, 30 NGML is often cited as sufficient for general bone health and overall well-being. But for these mood benefits, the research strongly suggests the impact is concentrated in the truly deficient group, those below 20.
I see.
So if your levels are already, say, 40 NGML, taking a bunch more vitamin D probably isn't going to magically lift your depression because you're not fixing a fundamental lack. It really tells us vitamin D isn't like a performance booster for mood. It's more like a necessary foundation. If you fix a serious deficiency, you might see things improve. If you don't have that deficiency, the benefits seem to drop off quite sharply.
So it's about restoring a baseline, not necessarily enhancing beyond it.
Gotcha. You also mentioned another group that seems to benefit more.
Yes, that's another key point in the data. There seems to be an increased benefit for people who also have chronic inflammatory conditions.
Inflammation, how does that connect?
Well, It reinforces this idea that vitamin D's role in mood isn't just about neurotransmitters. It's also known to have anti-inflammatory effects. And we know that ongoing systemic inflammation is linked to mood disorders too. So it's possible vitamin D is helping on two fronts, boosting mood chemicals and calming down underlying inflammation.
That's a really interesting dual pathway.
Yeah.
Okay, let's switch gears slightly. Anxiety often goes hand in hand with depression. Is the evidence for vitamin D helping anxiety just as strong? Unfortunately, no, not really. When you look at the actual supplementation trials, the evidence for anxiety is, well, much less robust.
Less robust how?
We do see in large population studies that there's a correlation, an inverse one. People who naturally have higher vitamin D levels tend, on average, to report less anxiety.
But, okay, correlation isn't causation. We say that a lot here. Couldn't it just be that people who are generally healthier, maybe they get outside more, eat better, just happen to be less anxious and have higher vitamin D?
That's precisely the problem. We can't disentangle it easily from just looking at population data.
No.
What we're missing are enough strong, consistent intervention trials, where you give one group vitamin D, another placebo, and track anxiety symptoms specifically.
Right.
Without that, we can't definitively say taking the supplement causes anxiety reduction in the same way we can tentatively say it might for depression if you're deficient. More research is definitely needed there.
And it's important we stress that scientific uncertainty. Even for depression, you mentioned the results are moderate, and not every single study agrees. It's still a mixed picture overall.
Absolutely.
Which means any decision to supplement has to be really carefully considered. And that leads us perfectly into what seems like the most confusing part of the sources, the dosing. The amounts seem all over the place.
They really are, and the complexity here just underscores why you absolutely need professional guidance. There's no single right dose of vitamin D for mental health that works for everyone. It has to be tailored to the individual, based on their starting levels, their health status.
Okay, let's try to break down the main regimens discussed in the research. There seem to be three distinct approaches. What's the first one, the sort of baseline approach?
Right. The first is what you could call a moderate daily dose strategy, aimed at sort of steady maintenance or gentle correction. This usually involves taking at least 2,800 international units, or IU, per day.
2,800 IU daily. And for how long?
Typically for 8 weeks or more to see an effect.
Let's just clarify IU quickly. People see that on supplement bottles. What does it mean?
IU, international units, it's just a standard way to measure fat-soluble vitamins like D, A, and E based on their biological effect, not just their weight. If you look at supplements in a store, you'll see common doses like 1,000, 2,000, maybe 5,000 IU.
Okay.
So 2,800 IU a day is right in that common therapeutic ballpark. And the research suggests this level over time can offer that moderate benefit for depressive symptoms we talked about, especially if you're starting low. It's designed to gradually nudge levels up.
That sounds fairly reasonable for someone maybe moderately low. But then regimen 2 hits the high weekly dose and the number just skyrockets. Why 50,000 IU a week? Sometimes for a year or more.
Yeah, that's a huge jump. This high weekly dose, 50,000 IU, is typically reserved for more severe situations.
Like what?
Like severe deficiency, or maybe people who have trouble absorbing nutrients, or those with really stubborn treatment-resistant depression, or other chronic conditions where you need to get levels up faster and keep them high.
50,000 IU. That's, what, almost 7 times the upper end of that daily dose range, just taken once a week. Why do it that way? Why not just take, say, 7,000 IU every day?
It leverages how vitamin D works in the body. Because it's fat-soluble, your body stores it. Giving one big dose weekly can actually be quite effective, sometimes even more effective, at quickly building up those stores compared to a smaller daily amount.
Oh.
It's a more aggressive approach, yes. But the goal is to rapidly push someone past that critical deficiency threshold, that 20 NGML mark, and keep them there, especially if they might struggle to absorb or utilize a smaller daily dose effectively.
That really highlights the need for personalization. It's not just take vitamin D, it's which strategy fits this specific situation. Okay, and then there's the third one, which sounds intense.
That's the acute intervention, a single dose of 300,000 IU.
Wow. 300,000 IU all at once. When on earth would that be used?
This is usually seen as a loading dose, a way to kickstart things very quickly. You might see it used, for example, right at the beginning when someone starts standard antidepressant medication if they also have confirmed severe vitamin D deficiency.
I see.
The idea is to flood the system immediately, correct that deficit almost overnight, potentially helping the main antidepressant therapy work better from the get-go, get them above that critical low level as fast as possible.
Okay, so looking at those three, the daily 2,800 IU for steady state, the weekly 50,000 IU for severe or chronic cases, and the massive 300,000 IU single shot for an acute start. The sources aren't really offering options, are they? They're describing completely different medical tools for different jobs.
Exactly right. They are absolutely not interchangeable. And, seeing those huge numbers naturally brings us straight to the issue of safety, because dealing with doses in the tens or even hundreds of thousands of IU, that carries real risks if not done properly.
Right. When you're talking these high doses, what's the number one safety concern highlighted in the sources?
The sources are unanimous on this. Safety starts with testing. You must confirm deficiency with a blood test before even thinking about these high-dose regimens.
Why? What happens if you take too much?
If you're already sufficient or even just borderline and you start hammering your system with 50,000 IUs a week, you risk toxicity. Specifically, the main danger is hypercalcemia.
Hypercalcemia, too much calcium.
Exactly. Remember, vitamin D's main job is boosting calcium absorption. Overdose on D, and you force calcium levels dangerously high in your blood.
And that causes...
It can cause a range of nasty symptoms: nausea, vomiting, constipation, confusion, but also more serious things like kidney stones, kidney damage, even heart rhythm problems.
That sounds serious.
It is. And because vitamin D is stored in fat, it takes a long time for excess levels to clear out of your system. So regular blood monitoring, checking both vitamin D and calcium levels is absolutely essential with these high-dose therapies. You have to ensure you stay within a safe therapeutic window.
Okay, so pulling it all together, what's the overall consensus from experts looking at this evidence? Are they saying everyone feeling down should get tested for vitamin D?
No, not quite that broad. The consensus really emphasizes a more selective approach. Experts generally agree that yes, vitamin D supplementation can be beneficial, but specifically for certain individuals.
The deficient ones.
Primarily those with confirmed deficiency, especially below that 20 NGML level we discussed, and often also those who have other conditions alongside, like chronic inflammation. So the strong message is really away from just blanket recommendations. It's all about individualized plans developed with and monitored by a healthcare professional. Precision medicine, essentially.
Makes sense.
And that's where the research is heading too, trying to figure out how to tailor doses even more precisely, looking at baseline levels, other health issues, maybe even genetics, to hopefully get more definitive guidelines someday. Because right now, they don't really exist in a one-size-fits-all way.
That focus on personalization seems absolutely critical, given the huge dose variations we've just walked through. Okay, so let's try to summarize the key things for you, the listener, from this deep dive. Two main takeaways, really. First, vitamin D seems to play a much more complex role than we thought, potentially influencing mood directly through brain chemistry, not just bones.
Acting like a hormone influencing neurotransmitters. And second, while it shows promise for depression, its effectiveness isn't universal. The benefit seems strongest, most reliable, in people who are genuinely deficient below that 20 NGML mark. It looks like a tool for restoring a deficit, not necessarily boosting mood in those with normal levels.
Which leads us straight to the most important piece of actionable advice from all these sources. Please do not try to self-diagnose or self-prescribe these high doses.
Absolutely not.
Before you even think about starting supplementation, especially with the kind of numbers we talked about today, the 50,000 IU, the 300,000 IU, you really must talk to your doctor. Get the blood test done, get personalized guidance. Given the complexity, the different strategies, and the real risk of toxicity like hypercalcemia, there's just no safe one-size-fits-all dose here.
Couldn't agree more. And maybe as a final thought to leave you with, consider this. The research strongly suggests the biggest mood benefits from vitamin D are linked to fixing a deficiency and often occur alongside chronic inflammation. So perhaps the biggest takeaway isn't just about this single vitamin. Maybe it points to something broader. Think about the deep connection between ongoing inflammation in the body, your overall nutrient status, and ultimately your mental health. It's a complex web and likely goes far beyond just taking one pill.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.